I've been suffering from blindness in my right eye on several occasions, and I've been to see the eye doctor, and they suggested that I go to the hospital and see and get an MRI of my brain. And after having the MRI, I consulted with the hospital, and they said that I seemed to have a blockage in my carotid artery and I needed surgery. Yes, I'd been to many hospitals, and they had suggested that I needed procedures regarding the artery that was blocked, the carotid artery which was blocked. And I needed to have procedures, and they suggested to me that they would do angioplasty. I wasn't quite happy with that result, so I started to do investigations myself by going to the internet and finding out exactly what my problem was. And by looking at the internet, I came up with what they call the gold standard, which wasn't the angioplasty. And I then started to look for a doctor in Bangkok who could carry out the procedure I was looking for. So yes, I've been to many people before this, many hospitals I might say, but they always wanted to carry out the procedure which I wasn't very happy with, which was the angioplasty procedure, which involved putting a stent in the artery. I'd looked at many people who had this particular procedure, and they seemed to have gone for the gold standard, which was open surgery to fix the problem. And that's what made me come to this particular hospital, Bangkok Hospital, because I could only find a doctor here who was willing to carry this procedure out. All the other hospitals in Thailand, in Bangkok especially, didn't have the facility for doing this, or they weren't prepared to do it. But Bangkok Hospital, with the doctor I had, he was prepared to carry it out. This was the only hospital, after visiting many other hospitals in Bangkok, who was willing to carry out the procedure that I wanted to have done, which was the open surgery procedure. So this was the only hospital that was prepared to carry that out. I also investigated by going to the other hospitals, by consulting other doctors. The price was quite important to me, and this was the most competitive price for carrying out the particular procedure I wanted.
This was an 80-year-old American gentleman. He had repeated episodes of temporary vision loss in his right eye. We call this amaurosis fulgens. It's painless, but it is an warning sign of stroke. He already seen several doctors at different hospitals, but his symptoms just did not get better. When he came to us at Bangkok Heart Hospital, we did a carotid ultrasound and reviewed his previous magnetic resonance angiogram. The scan showed more than 70% narrowing in his right internal carotid artery. This is a significant blockage and a real warning sign for stroke. He also had other health issues: heart disease, high blood pressure, high cholesterol, a small hiatal hernia, and lung scarring from past asbestos exposure. This added to his stroke risk and made his case more complex. We decided to do a carotid endarterectomy. That means surgically removing the plaque inside the artery. We used a patch from his leg vein to make an artery wider and safer. This helped reduce the chance of future narrowing. Carotid endarterectomy, or CEA, is often the best choice for patients with severe carotid artery narrowing. There's lower risk of stroke during the surgery compared to carotid artery stenting. Unlike stenting, which just compresses the plaque, CEA allows us to remove it entirely under the leg vision, improve both safety and precision. With proper technique and the use of a patch, the arteries stay open longer, which gives long-term stroke prevention benefits. For this patient, CEA was clearly the most effective and safest option.
Wonderful. A big improvement. The experience I had with the blindness went away completely. So I took it that the surgery, and I was advised by the doctor that it had gone successfully, it had been done successfully, and I was free from that particular problem I had. Excellent care after surgery. Everybody was very attentive and caring. I've had many experiences in Thailand of particular hospitals because I've had many procedures, and I've been in many hospitals in Bangkok especially. And I found that the way that Bangkok Hospital conducted itself and the way they treated me was by far the best I'd ever experienced. It took about a week for me to get back to normal, as you would appreciate. Open surgery just take time, or it does take time for recovery. So I would say after surgery, within a couple of days, I was able to walk around and conduct normal life. After about a week, it was almost as though nothing had happened, except you could probably see the scarring. As a matter of time, it took about maybe a week or two for me to fully recover and get back to normal again. The most impressive part of my stay in Bangkok Hospital was the attention I was given and the care I was given by the doctors and nurses. The doctor especially, I feel that he made me as part of the family of Bangkok Hospital. He took me through every aspect of the procedure I was about to have. He treated me with so much respect, which made me give him all my respect as well. And I'd never experienced that sort of thing from anywhere else. So in general, the nurses in the hospital and the doctors gave me all the attention, which was, for my life, was the best part of the experience.
The surgery went really well. No stroke, no nerve injury, no complications. Everything went just as planned. He recovered nicely and was able to go home safely on day 5. It was a great result, especially considering his age and medical history. This case presented several challenges. The patient's advanced age, 80 years, and multiple comorbidity mean that preoperative preparation was essential. We had to carefully assess and stabilize his condition before surgery. Protecting the brain and nerves, that's one of the most important part of this surgery. Here at Bangkok Heart Hospital, we have a skilled surgical team, advanced technology, and experience in treating complex cases like this. If you or someone you care about has carotid artery disease or stroke symptoms, we are here to help.